My name is Jeanne. I work at the Prairie North Health Region in North Battleford, Saskatchewan at the Battleford Union Hospital. I work in the operating room. I'm an LPN ORT. The things I like about my job is it's kind of a secluded area in healthcare that a lot of people, well, there's no visiting allowed in there, and people don't come there unless they're in a situation in their lives that is fairly difficult to deal with. And I find that we have just a small amount of time to make them feel comfortable, to share our knowledge with them, to help them understand what we're going to be working at, how we're going to be, how the procedure is going to flow, and to help them feel at ease. And I also really like about my job the fact that we are always changing. We're in a job that's fairly technical, and procedures and equipment are constantly changing, and so we're always being in service with new equipment and new procedures. The challenges that we face in our job is the technology that changes so quickly. Also, it's a challenge to work as a team with different personalities and different focuses and interpretations of what we think is going to happen. Also challenging in our job is sometimes the overtime, because we do on-call. We provide emergency services 24 hours a day at the hospital. So sometimes if you're on call for, say, a Monday night, you could work your shift Monday and then continue on call through the night, and you may have a really busy night that has like maybe 8 hours of surgery, and then we are expected to be at work the next day again. One thing that I would like changed, if possible, is to adjust the overtime, to adjust the staffing. And some days in the theater as well, you do work short, so then everyone just has to pull a little bit harder, and so if we had better staffing, that would be great. I am very proud to be a member of CUPE. I think that the union does a lot of things for us. They provide education and actually provide opportunities to attend conferences and to be involved in your union. I think the people that work in the union for us are doing a job that I would not want. It's not something that I would feel comfortable doing, so I appreciate their efforts. I think it's important that we are allowed to work to our full scope, because we have pursued the education to be able to complete these duties. And I think it's a big source of frustration that when you are able, when you have the ability and the capability to perform a job, that you're not recognized and prevented actually from doing that. I think the public does not know what LPNs do. And I think just being able to answer their questions a lot. We have a lot of knowledge to share. We're a great group of people. I have so much admiration and respect for my colleagues, and I think we're doing a great job, and we just have to share that with the public.